Hi everybody, this is Dr. Paul Terrio here, naturopathic doctor, and I'm here to talk to you about food intolerance assessment methods. So, just to be clear, this video is not intended as medical advice. The procedures described here should be done only under the supervision of a qualified naturopathic doctor or other qualified practitioner, such as, a medical doctor, an osteopath, doctor, nutritionist, a chiropractor, just anyone who knows what they're doing. Any who attempt to do this on their own do so at their own risk. I take no responsibility. I'm telling you right now, do it with someone who's qualified. So, about me. I'm a naturopathic doctor practicing in Calgary. My practice focuses on autoimmunity, infectious disease, autism, digestive health, detoxification, and cranial work. I use nutrition, homeopathy, biodynamic osteopathic manipulation, acupuncture, drainage, hydrotherapy, and herbs predominantly, but a couple of other things as well. That's a photograph of me if you want to see. So, why food intolerance? Naturopathic medicine and its predecessors have long found diet to be a key component in healing. This goes all the way back to the Hippocratic Corpus, which is about 2,500 years before the present, when there were many dietary prescriptions given. So Hahnemann and Benninghausen, who are two famous homeopaths in some of our predecessor professions, which were the homeopaths, eclectics, hydropaths, and osteopaths. So Hahnemann and Benninghausen were homeopaths, and they had diets and regimens that they knew they would prescribe to support the action of the remedy and to not interfere with the action of the remedy. They are more concerned with the action of the medicinal substances they were prescribing and prescribed a good diet that would benefit the patient, but that wouldn't interfere with the action of the remedy through a great deal of like spiced foods and things, which were quite uncommon at the time. So Father Sebastian Knipe would restrict the diets of his patients and remove unhealthful foods. He was very famous. He made hydrotherapy world famous back in the 1800s. He was one of the three most famous people in the world for that. That's him on the left, and that's Samuel Hahnemann on the right. Lindlar, who was a very famous naturopathic doctor in the early 1920s and 30s, restricted many foods, such as meat, from the diet, replacing unhealthy foods with healthy ones. And he also began to notice that certain people just didn't do well on certain foods, more specifically. Weston Price, who is a dentist, also noted the addition of modern foods to indigenous diets caused disease and multiple mental and physical abnormalities. So that's Weston Price on the left, and that's Henry Lindlar on the right. And the inscription reads, "Nature's remedies are the best." So, the idea of food intolerance likely originated from Lindlar and developed onward from there. There's about 5 methods that I'm going to describe to you right now. I'm going to describe how they work, and I'm going to describe their advantages and disadvantages, and why I ended up preferring the Carroll Method. Now, I wish I could give you a full and complete history of all of these things, but that would likely not be a YouTube presentation. That would likely be like a full-on book. So we'll just have to do a little basic introduction to each of them. So the Elimination Diet is the first. This involves going on a diet presumed to be anti-allergenic. That's actually pretty important. And reintroducing potentially problematic foods and observing for the recurrence of symptoms or any issues that might emerge. The common foods are wheat, dairy, eggs, and quite often corn. So, the pros, this is relatively inexpensive, and it involves the patient in their diagnosis and their therapy. Not all patients want to do this. Some people are just so tired and so exhausted, they do not have the energy to go on a 2-week diet. So that might, to really get themselves to kind of an elimination diet state. So that may be a con. The results can be ambiguous. This takes a great deal of effort. The diet can be a challenge, and it doesn't differentiate fundamental intolerances from the temporary. So let's say you have a reaction to a particular additive to food as opposed to the food itself. It won't be able to differentiate that. I found this a lot where people wouldn't be able to eat wheat in North America, but they'd go to Italy and they could eat wheat all day long and no problem. So, yeah, it tends also, I would say that, from someone who does the Carroll method, quite often the elimination diet does not determine the Carroll intolerance. So those two things are a little different. Reactions might be subtle and they might be long term, they might not be immediate. So the elimination diet does tend to detect the immediate reactions, and the longer term ones, the more subtle ones, tend to get left out. And it also doesn't detect foods that are bad in combination. So, allergy testing developed from allopathic research into immunology. It's determined either by the presence of immunoglobulin type E, there's multiple types of immunoglobulins, this is one specific type, in the blood, or scratch testing of allergens directly onto the skin. It's done primarily by allergists, but also by SLIT practitioners, and dealt with by desensitization or allopathic medications. So the most two famous being EpiPens for people who get anaphylactic allergies, and diphenhydramine or Benadryl to reduce allergies. So here's a kind of a photograph of scratch testing on a dog. It's the best one I could find, I'm sorry. So they basically make a little scratch with the allergen, and then they'd measure the size of the wheal that resulted. That dog's really allergic. So pros, it's often covered by public Medicare or insurance, and it can detect life-threatening anaphylactic allergies. Not all methods can. As a matter of fact, this is the only one that can detect those. And it's often very helpful for avoiding things in asthma and respiratory issues. And it will point very clearly to therapies. So there are ways of desensitizing people to allergies of this nature, and they can be very helpful in dealing with things like asthma, respiratory issues, or something more life-threatening. The cons is that it does not, like allergies, this classical IgG or IgE allergy does not encompass all reactions to foods. Often allergies are secondary to the primary intolerance, which we'll discuss when we come to the Carroll method, and they're often unhelpful in other chronic conditions. So getting rid of just the IgE allergies can often not benefit many other conditions other than asthma and respiratory issues. So immunoglobulin testing. Blood tests, which this is basically a blood test which detects antibodies in one's blood to a set of food. So they usually use IgG, sometimes IgA or IgM, but they do not do IgE, which occurs with classical allergies. This is different than what we would determine as a type 1 allergic reaction or an IgE reaction. So they take your blood, screen it for antibodies to foods. So here's just a sample test that I got from RMA Labs, which I have no affiliation with. The more immunoglobulins, the more reactive a person is to that food. So we can see from this person's pretty reactive to goat milk, casein, and sheep's milk, and cow milk as well. They're pretty all of them, as well as egg white. So we can see kind of the yellow ones are medium and the red ones are high. So you can see this person's got a few things going on there. So the pros of this test, it can be done by anyone who's got lab access, and there's no need with difficult diets or procedures that require expertise. Cons are it's usually not covered by insurance, and it does often need to be repeated at intervals to determine what's staying and what's going. You need exposure to the food to determine, whether or not there are immunoglobulins to it, and it is very ineffective with leaky gut syndrome. So if you've got like just a generally bad digestion that lets in many types of food particles into the circulation, everything's going to show up. It's not going to give you much to go off of. There's also issues of cross-reactivity. So immunoglobulins to one type of food may in fact be for another. And there's also the issue of additives. So energetic testing is another one. It's called This could be from Vega testing, from RAFT or the radio artery food test, electrodermal testing, and muscle testing, etc. There's a number of methods, and you basically use them to determine the energetic response to foods. It's very cost effective. You get immediate results, and it determines many more superficial intolerances. Now the con is it tends to miss the deeper ones that we get to with the Carroll method. So we're going to go into that right now. So the Carroll method was developed by Otis G. Carroll, a naturopathic doctor, or sanopractor, as many NDs were known at the time. He was a student of Lindlar, and he'd already developed constitutional hydrotherapy, but found a series of cases that weren't responding to hydro, and determined that stomach and the digestive tract were the issues. So he began using an assessment procedure he developed to determine what kinds of foods a person could digest. This procedure can be performed in person, as I do, or in a blood sample, depending on the scope of practice of the ND in the area. So the pros are it's very cost effective. You get immediate results. It can be done in person or at a distance, with a blood sample, and it's got about 100 years of experience behind it. This is a very reliable method. It's been performed on about 500,000 people. So it's also billable to benefits, and you can assess individual foods. So far, all of the methods we've described can't determine the response of an individual patient to a food. This method can. Cons are it takes training, practice, and expertise, and the categories aren't socially well known, making eating out a challenge for some of them. So let's listen to a quote from Otis G. Carroll. That's a photograph of him on the left. Health must at all times come from and be maintained by digested foods. Naturopathic physicians understand this principle and use it to repair the damage done to organs, tissues, and cells, which have become depleted of the necessary constructive elements. These necessary elements can come only from digested foods. After a food is digested, it goes through the circulation to every organ, tissue, and cell. Remember, this process begins first with the digestion of food, and no drug yet offered can rectify the damage done by failure of digestion. I think he said this sometime, before he died in the 60s. So, and this is still true. There's no treatment that can remedy bad digestion. So the Carroll method screens patients for a number of food intolerances. These are the big ones right here: fruit, sugar, potato, meat and mined salt, and dairy and egg. And there's some combinations as well. So we'll just do a very basic overview. So fruit includes all fruit and a number of fruit additives: annatto, sorbitol, polysorbate 80, and many packaged foods. Fruit flavoring counts as fruit. Citrate and citric acid counts as fruit. Many sweeteners count as fruit. Wine, and many vinegars, like apple cider vinegar, count as fruit. Avocados count as fruit. Sodium lauryl sulfate is it checks out as a fruit here. Now, thankfully, pineapple, tomato, and melons do not count as fruit. Potato includes potatoes, also yams and jicama. Dextrose, water softeners usually kind of check out as potato, and things grown on potato media like B vitamins and yeast. It includes most packaged foods and baking powder. And I've noticed in my own personal practice that potato is like the most addictive one. People get off potato, they'll feel great. Drive by a fry store and they're in the drive-through not even knowing what they're doing. So it can be pretty hard to come off of potato. It's often found in starches and plastic wraps, strangely enough, and beer and some fermented products too. Sugar. Sugar includes all sugarcane products. Sugar substitutes as well. High fructose corn syrup, rum for those of you who are connoisseurs of the fermented beverage, and wine often as well, especially only wine that's sucrinated. So I found Italian wines it is illegal to sucrinate them. So sucrinate them means you just add sugar to the grape juice when you're fermenting it. Italian wines won't. Any other wine that's not sucranated would also be presumably good. And of course, sugar is present in a ton of processed foods. Egg, pretty easy and obvious. All kinds of egg. And supplement made from these, like, egg whites and egg proteins and egg calciums. Dairy is also pretty easy and obvious. It includes not non-dairy creamers, lactose-free dairy, calcium diphosphate and tricalcium, which tend to be dairy-derived, and lactoferrin, which often is sprayed on vegetables to freshen them up, as well as many, many probiotics. So meat and mind salt almost always go together. So meat includes all land animals like birds and mammals. It does not include fish. So it includes things like bone broth and also marshmallow, which is made out of beef tallow. Now, mind salt is an odd one. It's not salt in general. It is specifically all salt that's kind of dug up, including Himalayan crystal salt and processed salt. Unprocessed sea salt is fine. If it's processed sea salt, then it checks out as mind salt when we figure it, when we check it out on people. My brand, which again I have no affiliation with, is Celtic Sea Salt, Sel de Mer. It looks like something you scraped off your windshield in the middle of winter, but it's delicious and it has all sorts of physiological benefits and trace minerals. It's so good. So I would, people who have this intolerance, I usually just encourage them to purchase that salt. So common combinations, there can be many. Fruit and sugar together is often a combination of with eggs. So most people who are egg intolerant can't do fruit and sugar together. The issue with a combination food is that you can have those two foods in a combination separately, but you can't have them together. By at least 4 hours, sometimes 8 are in people with weak digestion. So fruit and sugar is a common issue with egg intolerances, which includes most wines. And again, for those of you who are egg intolerant and fruit and sugar intolerant together, Italian whites, those are the ones. Dairy and gluten or grain, potato and gluten or grain, and sugar and gluten or grain. So there can be a little discrepancy there. Some Carroll Method practitioners utilize, do the assessment separately for gluten and grain, like I do. I find mostly it's gluten, but I have found some people that have a combination grain intolerance plus one of these things. And if anyone is kind of gluten sensitive, this is usually the issue. If it is a true Carroll Method problem, usually it's a gluten plus something issue. So quite often it'll be like potato and gluten or dairy and gluten, things that are often together. So what are the benefits specifically of removing a food intolerance? Well, I think you guys can tell I favor the Carroll Method. It is, in my view, the best. It is the most clinically accessible, it is the least expensive, it is the most immediate, and the food intolerance is fundamental. The Carroll food intolerance. Quite often, things like the IgE intolerance, the electrodermal intolerance, the IgG intolerance, and the things that are found in the elimination diet are the result. Your body reacts against them because you're eating the Carroll intolerance. So when you eat your Carroll intolerance, the digestive apparatus breaks down. Bacterial fermentation occurs, and that produces a number of toxic chemicals that, will often attack at one's weakest point. This can be determined by genetics. It can be determined by injury, either physical or toxic, that you've had in the past. And it can be determined by the state of your vitality. And quite often, you eliminate the Carroll intolerance, everything else disappears. So, how do you figure out what your intolerance is? The Carroll Method, there is an institute where where naturopathic doctors are trained in the Carroll methods, and it is called the Carroll Institute, oddly enough. I've taken my training there myself. They have an index of a good number of doctors there. I'm not in the index. I need to talk to Tish about that. But, if you want to look for someone who can do this assessment for you, you can. Naturopathic Medicine Institute doctors, so we're all naturopathic doctors who are members of this, will know how to generally do this. They will know how to maybe not perform the assessment, but they'll know how to send off for it if this is what you want. Or you could always email me. I will find you something. So, do you have any questions or comments? You can give me an email at drpaulterio.nd@gmail.com. You could visit my website at drpaulterio.com. You can go to the Carroll Institute to, again, see if there's anyone to perform the Carroll Intolerance method for you, or you can go to the Naturopathic Medicine Institute to see any of the naturopathic doctors that we have that can interpret this for you and help you kind of go for it. So I really hope you guys enjoyed this. I'd love to hear any comments or questions that you have about it, and don't forget to like and subscribe this video here. So take care of yourselves. We'll talk soon.